Investigators in Highland Park, Illinois, are still trying to piece together a motive that prompted a 21-year-old man to open fire from a rooftop on a July 4th parade, killing at least 7 people and wounding at least 20. Here to talk about the psychological and psychiatric profile of this mass shooter, at least as far as we know, and what sort of patterns we're starting to see in these mass shootings, is Dr. Daniel Bober. He is a psychiatrist and chief medical officer at Odyssey Behavioral Healthcare. Dr. Bober, thanks for joining us. What jumps out to you about this latest mass shooting?
Well, unfortunately, there is a contagion or copycat effect that when we have a mass shooting, it very often occurs in about 2 weeks of proximity to the one before it. I think people are going on social media, they are being inspired by hatred and mass shootings and social media in general, and I think that makes them willing to act out, especially when they feel like they're marginalized or on the fringes.
And what is it about younger men between the ages of 18 and 21 or 22? I mean, that seems to be the profile for so many of these mass shootings. Young white men, clearly lonely, clearly cut off from not having many friends. What is it about that causes them to reach towards violence?
Well, first of all, there are more white men in the country, so statistically, it's going to probably be more white men than African American men. However, that being said, I mean, I think that there's a reason that we talk about raising the minimum age for firearm purchases, because at that age, your brain is still developing and you're much more impulsive. You don't weigh the future consequences of your actions. You have higher rates of substance use disorders. So I think there's a lot of factors going on there that make this much more likely. And in society, there have been rates of depression and anxiety that have been increasing. Suicide rates have been skyrocketing. So I think there's a lot of societal factors at play here that really influence this outcome.
And yet there's an effort by Congress to try to reach down and get more people in terms of grabbing them, putting more money towards mental health and trying to make sure that you can catch people before they fall between the cracks. The bill that Congress just sort of passed to try to do that and giving states more money for things like red flags and trying to help identify, do you see that as being effective?
I do think it's a start. I think part of the problem is mental health in general gets sort of a bad rap. You know, people who are mentally ill are not the cause of mass shootings. Only 4% of interpersonal violence is due directly to people with mental illness. Hatred, intolerance, that is not a mental illness. Hating someone or holding a grudge against them, that is not mental illness. So mental illness is not directly responsible for all these firearm homicides. I think what is a major factor is the massive arsenal of weapons that we have in the United States, more than one for every person, and the easy availability. Guns equal death. We might feel safer with them, but having a gun around increases the risk of suicide, increases the risk of homicide, increases the risk of accidents. So if we want to live in a free society, and I believe in the Second Amendment, we have to realize that more people are going to die with all these guns around.
What is it about the American psyche that makes us the land of the guns? I mean, is it the Wild West culture that we had for so many years? Is it just the Second Amendment? I mean, what is it about American individualism, the fear that we have of people who are different? What is it that makes us so prone as Americans to have guns?
I think it is a uniquely American phenomenon. I think we have a lust for violence. Violence is part of our culture. You see it in movies and TV and video games. We are a violent culture. We are the greatest country in the world, but we are a culture that was born out of violence, and it is very much a gun culture.
So how do we change it? How do we, I mean, obviously people would say, well, first we have to recognize that we have a gun culture. And I think most Americans would probably recognize, yes, we do have something unique about that. But I mean, it feels like people are so entrenched in terms of their own positions about guns. And polls found, for example, that I think it's something like 45% of Republicans believe, you know what, we're just gonna have to deal with the fact that there were more mass shootings and more violence because that's the price we pay for having our gun freedoms.
You know, that is not probably an unpopular view among that party. But the thing is, we have to decide, do we want our freedoms? Do we want to be able to have guns? And are we willing to let people die? Are we willing to let children die? Is that how we want to live as a society? How can we take the moral high ground in anything we do around the world if that's the society that we live in? It's a value judgment that people are going to have to make for themselves. For my part, I don't take a political stance on it. I look at it as a public health issue. We regulate cars. We tell people that you can drive a certain speed limit. We tell people they have to wear their seatbelt. We don't allow defective cars on the road. I think we need to regulate guns the same way that we regulate cars and make it a public health issue.
In order to do that, we would have to cut into perhaps the profits of the gun industry and certainly fight back against the incredible lobbying hold that they have on Congress. Is that also perhaps part of the problem? It's not so much sort of guns per se, rather the fact that we have essentially a corrupt political system that enables corporations like gun manufacturers to essentially write their own laws.
Listen, I think that's true of a lot of industries. A lot of industries, are influencing Congress, influencing politicians. And the gun industry has been essentially immune from any civil liability. They also really don't answer to anyone except themselves. So I think that's a problem.
The shooter in Highland Park, he was a rapper who went by the name Awake. In some of his recent videos, he depicted mass murders. Apparently, the police had been called to his house a few years ago because his family members said that he threatened them with violence, threatened to commit suicide, threatened to kill them. And yet he's still able to somehow go out and buy more firearms. That's puzzling to a lot of Americans.
I worked a lot on the Parkland shooter case. I worked with the police. I worked with victims in that case. And that is something that is also true. I mean, the police had so many encounters with him, and still he was able to obtain a firearm. And that's what I'm talking about when I say lax gun regulation. This is something that we need to limit, and we need to do it on a national level. We need to have national extreme risk laws. We need to be able to take guns away from people. Police need to be able to do it. Parents need to be able to do it by petitioning the court. This is a serious public health problem.
There are a lot of public health problems across the United States, and it just seems like this one, it pops up every couple of weeks, as you mentioned, and there's more mass shootings in the United States. I think there's been something like more than 200 mass shootings, and yet we almost seem like we're just sort of used to it. Is that part of the problem, that now it's just what it takes to sort of shock us as Americans becomes more and more extreme?
Well, people use the term the new normal, but there's nothing normal about this. But I think after Sandy Hook, after children were massacred and nothing really changed, that's when I really realized that things are not going to change, because people have become so desensitized to it now. It has become a bi-weekly phenomenon, and people just kind of flip the channels and they turn to each other and they say, oh, another mass shooting. It's terrible that we have to live that way, and that has become the new normal, so to speak.
And is that part of our own psychological defense mechanism, that we just sort of say, okay, well, it's going to happen on TV, and we're just going to sort of tune it out because they have to actually deal with what our kids, our families might actually be facing in schools is almost too much to comprehend?
I agree. I think it's a form of apathy or learned helplessness. After a while, we feel so powerless to do anything about it that we just move on to the next topic.
We've talked a lot with several of our guests about different sort of creative ways. In fact, a guest just a few minutes ago, we were talking about a solution that doesn't involve government, which is that we have insurance companies. We essentially force everybody who has a gun to carry liability insurance, with the idea being that just as aggressively as insurance companies are with who pays the bills for medical bills or car accidents, you get the insurance company involved in gun violence, and suddenly they perhaps put a clamp down on guns and who can have them. Does that seem to make sense to you?
I don't know if it would cut down on the deaths from guns. I still think having all these guns around, we have 23 times the rate of firearm homicides compared to other industrialized countries. Having a gun in your home increases the risk of suicide by over 3 times, homicide over 2 times. It's just having these guns around. We want to believe that we're safer, but we're actually not safer. With more guns around, more people will die. That is the bottom line.
And police, I mean, they're some of the most outspoken in terms of the arsenals that they go up against. And we've seen time after time where they're afraid of the AR-15s that they may be facing in gun battles or fights with criminals.
Absolutely. The police are feeling outgunned because 18-year-olds can go into gun stores and essentially purchase a rifle that is a weapon of war. And that is pretty crazy to me.
As far as people who have to deal with gun violence, whether it's somebody who knows somebody who got killed in a mass shooting or were injured or what is there a healthy way for sort of grieving and dealing with this kind of episode in your life?
Well, I think people grieve differently, but I think, there's an initial shock and a period of numbness. And I think if you lose a loved one to gun violence, it's something that never really goes away, but it becomes something different and you learn to live with it. And it's just something that very often people will need professional help to deal with.
And for parents who see their own children dealing with, typical adolescent depression or suicidal ideation, or perhaps, fantasizing about violence, what should those parents do?
Well, I think they need to look for the warning signs, changes in sleep, changes in appetite, spending an inordinate amount of time on the internet and cyberspace, isolating themselves, withdrawing from their friends or their family. I think all these things are things that we need to be looking out for. And obviously, keeping an open line of communication so that our kids can come to us when they're really struggling. And I say this all the time: when you can't stand to be around your kids, when you're at the end of your rope, that is when they need you the most.
Dr. Daniel Bober, he's the Chief Medical Officer of Odyssey Behavioral Healthcare. He's also a psychiatrist. Dr. Bober, thanks for doing this today. It's not an easy topic for any of us, but we appreciate you trying to help us sort through things. And thanks for being on the program.
My pleasure.